Welcome to Muted in Medicine, the podcast where we break the silence on the untold stories and pressing issues within the healthcare professional. Join us as we dive deep into topics that often linger in the shadows of medical corridors and are not discussed in conferences, meetings, social gatherings, and in the hallways. They are often hiding. From navigating errors and facing litigation to the often overlooked realm of mental health among healthcare professionals. Through candid conversations and storytelling, we aim to amplify the voices and shed light on challenges that resonate across the medical landscape. So grab your stethoscope and a cup of coffee and tune in as we uncover the layers of complexity in the world of healthcare that are so muted yet so profoundly impactful.
Hello, everyone, and welcome to Muted in Medicine podcast. My name is Saba Fatima, and I'm a pediatrician with a passion for helping healthcare professionals facing secondary trauma in medicine. The podcast was started because of the need that I felt going through a traumatic event at work, like an unexpected outcome, imposter syndrome, grief, a microaggression, and not having a safe space to have those discussions, and hence feeling quite alone in that process. The goal of this podcast is to have those conversations for our audiences. So if they are feeling alone after something terrible that happened at work in healthcare, they can tune in. Today, we're talking about shame in medicine. It sounds odd when you say it, because healthcare in general is such a coveted field. And when you think about it, shame is not the first word which comes to your mind. But the time that I have spent working in healthcare, I have noticed experiencing shame and also see it come up in my peers, in my trainees, and in my team that I work with. I felt shame as a medical student, as a resident, as an attending, as a mom, trying to balance both work and home. Also, I felt shame when I got sick, shame of having to call out from work or not being able to perform 100% with that sickness, feelings of not being good enough, failure, mistakes, just general feelings of inadequacy, and apologizing in that process. However, I have never seen someone say the word shame. It's quite unspoken, right? Brené Brown says, shame does not survive when it's spoken, which means the more we tell our stories, the less shame can survive. And so today we are going to have this conversation without reservations, say the word shame out loud, share our stories, and create common words around it so we can know when it happens to us. I have with me today Dr. Melissa Ortiz. She is a dear friend, an ER physician, and also a certified peer support specialist. Dr. Ortiz and I share the common interest of fighting shame and trauma at work through creativity and writing and storytelling. So I'm very excited to have her here today. Dr. Ortiz, welcome to the show.
I appreciate that intro, and I appreciate what you have to say about shame, and I'm so open to having this conversation with you today.
Yeah, and I'm very excited with what we're going to talk about. We start out our podcast by asking everyone a slightly positive question. What brings you joy in medicine today?
I wish I could say everything, but I think what brings me the most joy in medicine is getting to work with some of my favorite people, meeting kind, interesting patients, and knowing that I helped provide ease and comfort and healing.
Yeah, that's very valuable, I think, and most of us will agree with that. As getting into the topic, how do you define shame?
Shame to me isn't saying I'm doing one thing bad, but saying that my whole person is bad. Does that make sense? It's different than guilt in that way, saying, oh, I did one thing bad, whereas I'm a bad person. I'm a bad doctor. I'm a bad mom. I'm a bad human. And a lot of the times that's been ingrained in us since childhood, really. But it can really become deeper seated than that, with repeated stimuli. So in medical school, I think, well, it even probably starts in undergrad when you're trying to study for the MCATs, or trying to get into a certain class, or trying to apply to med schools and things like that. If you don't get in, there's something wrong with me, or what's wrong with me that I can't sit and study for hours and hours. Or, in med school, what's wrong with me that I didn't make this connection that my peers seem to have made quickly? What's wrong with me that I didn't know the answer immediately when I got pimped? Why didn't I know that nerve? Why didn't I know that, special technique that I never read about? Why didn't these things magically come to my mind? In residency, why am I not getting it, the comparison to your peers, or feeling like you're not as good as your attendings, or you're not as good as someone who has a higher level of understanding or expertise than you do. And then as an attending, you can feel shame. Well, now you've got the work-life balance more so. Like, I should have this understood. I should have this down. Right. What's wrong with me that I don't? Again, comparison is the thief of joy. And I think that also really augments shame in medicine.
Yeah. And I would absolutely agree with all of those. And it just makes me wonder, does this come from, right? Like, what are the cultures and ideals in medicine that gave birth to shame? Like, when I was researching on this podcast, like, I read something which was back in the ages about what an ideal physician would be. And it just made me ask the question, like, what is an ideal physician, right? Like, where did this all come from?
Yeah. And an ideal physician, when I think of that, I imagine a man, believe it or not. A man in a white coat, clean, pristine. He's got his button-down shirt and he's got his tie on, probably red. It's his wireframe glasses. Always has a calm manner, never gets flustered, always has the answer, and is really good with procedures, really good with their hands, and just seems to exude an air of confidence and calm when he walks into the room.
And it was interesting that you said it would be a man. I mean, it's just...
Well, I think of Norman Rockwell's painting. That's exactly what I think about when I think of the ideal physician. And that's exactly what I pictured in my mind. So, there's some open sharing there. Yeah, I imagine a man. The ideal physician is a man.
Right. And that's very interesting that you said that. I hadn't thought about it. But I think that might be giving birth to like some of these expectations that we have around physicians and the perfectionism that we have. And it's been going on for several years. I think when we went to medical school, we had it. And even now, the students who are going to medical school, they still work around the same ideals. What are some of the ideals that you think are still ingrained, and when we were going to medical school, they were still there? And how could they relate to shame?
I think the first thing that came to my mind was, don't speak unless spoken to. Don't disagree with anybody, which doesn't make sense, because if we're trained to be the highest thinkers, the highest diagnosticians, well, aren't we supposed to disagree with what other people thought if it's wrong? Do you know what I mean? So I feel, and maybe this is just being as woman, I feel shame having a strong opinion about something. And then, but I think you can see that in medicine too, is like the germ theory, right? People really shamed the physician who said you need to wash your hands. At first, and now that's dogma. We wash your hands.
Right.
That's what got us through COVID-19. I think time is a big one. I remember as a med student, I was told that I need to show up earlier than the intern, and the intern needs to show up earlier than everyone else. So when do I show up? At 3 a.m.? What do I do? Do you know what I mean? And 15 minutes is early, on time is late.
Right.
Great. So for someone who works night shift and doesn't know what time it is ever,
Right.
here I am. I'm just living with it.
And as medical students and interns, like you show up before everyone, you leave after everyone leaves, like that kind of thinking.
Yes. That's another point of time. Oh, and heaven forbid you have a personal thing you have to take care of. Right? Like I remember I had a friend in residency. She was on she was an ICU rotation. And her child, her 6-month-old child had a severe medical condition, just got diagnosed. And I remember her talking to me about feeling heavy about having to ask to go to the appointments. And I remember feeling shame for her, like, oh, I hope you don't get ridiculed for wanting to leave to go take care of your kid.
Yeah.
Why is that?
Right.
But again, I think that also speaks to the ideal position being a man who has a wife at home who takes care of all that.
Sure. Yeah, I never thought of it like that. Yes, that makes absolute sense. And even I think a lot in medical education, right? Like there's a lot of shame there because for a long time the culture is about asking questions, and if you don't know, then that's a bad thing. And also about getting high scores and failure, like failure is a bad thing. So all those things are also ingrained in the culture as well.
The questions one is very activating for me. I immediately went back to myself as a med student.
Right.
So it's important to ask the right type of questions, right? So definitely don't ask a question that's going to stump somebody.
Right.
So if you need to ask a question that you already know that somebody knows the answer to.
Right.
And why is a loaded question, right? Like
Right.
I remember, and I can see it now in my daughters. One of my things that I truly have been looking forward to is my daughter asking me why. And one time she asked me why, and I said, all right, girl, you want the short answer or the long answer? And much to my happy mother heart, my mother, young daughter heart, I want the long answer. Yes. I can't wait to give you the long answer. Whereas oftentimes you get shut down and you realize, well, it's because the person you asked that question to didn't know the answer and they feel stupid. And so now they need to transfer that to the question asker.
Right.
Does that make sense?
Yes.
And like, heaven forbid you ask a question when the attending wants to go home. He gets to go home on time. She gets to go home on time. Don't hold me up.
Right. Yes. So you can't ask. There's no right time to ask a question.
There's no right time. And heaven forbid you don't already know the answer. And then what are you supposed to do? Exactly what we tell our patients not to do. Google it.
Yeah. So why do you think that is though? Do you know? Because I mean, we all went through it and maybe we're making others go through it. It's just so ingrained, right? Like,
well, I think the root of it is that we all need to realize that we're mirrors for each other. We're all a reflection.
Right.
So if I have realized that if someone has a very passionate response to something that I did, they already feel some type of way about it. They already have their own ingrained mindset and paradigms, I guess, with that. So oftentimes I feel like if you ask a question and the person doesn't know the answer, they probably feel stupid, shame, whatever. That feels yucky.
Yeah.
Time for you to feel it. How do they get that off of them and back to you? And so like, how dare you ask me a question like that? Why wouldn't you know the answer to that already? When really they're masking that they didn't know.
Yeah.
But we're all mirrors. But truly, I don't take anything. It's taken me 30 plus years to understand this, but don't take anything personally.
Yeah.
Everyone's coming at it with their own background, their own baggage. We're all the main character in our story.
Yeah. I love that. Yeah. No, that's so true. Like we've all gone through it and people are still, and even, I mean, we're talking about medical education residency, but even when we're practicing as independent providers, like there is still a lot of shame. Like it doesn't go away. I think it pervades through, and it's a different kind of shame, right? Like when you're working as an independent provider, the shame after making an error or something went wrong and now you're the person in charge. So that still exists. And then we can talk more about shame in women as well. of being a woman and not being able to do all the roles perfectly. What do you think about that?
Yes. Oh, absolutely. Well, and to make sure I finish the point before, it also feels bad to admit a mistake. And right, we're also taught, watch your language when coming to that. Don't own the mistake. An example from my shift that I just got off of yesterday. I had a woman who was in a domestic violence incident.
Mm-hmm.
She had head pain. She was struck twice with a fist, and she had like bruising over her cheek here. No cervical spine tenderness. I verbalized out loud, I'm going to get a CT scan of your head. I'm going to get a CT scan of your face. And I don't need a CT scan of the cervical spine. I'm going to get an X-ray of the thoracic spine. Well, of course, I ordered a CT of the face and the cervical spine. The CTs are red. I didn't realize it until after, get her dispoed. And of course, it's at the end of my shift. What do I do?
Mm-hmm.
My first thought was, you idiot. You even said this out loud, right? And then thankfully I had this soft, kind voice say, it's okay. You were stressed. This was actually ended up being two patients in one room. So it was a multi domestic violence situation. You got, I gave myself compassion is a short story. And I called the radiologist. I told him, and I even said, I made a mistake. This is what I was looking for. I accidentally ordered this, or I ordered this instead. And he said, well, let me go look at it. I should be able to see what you're trying to find. We was able to see it. I went to the patient. I explained what I said. Now, there were police officers in the room. So there's now 4 people in the room that I had to say, I made a mistake.
Sure.
This is what I did. And then I made sure I wrote that in my note. And I said, I don't think that you need the dedicated face CT. We did talk about that. This is what we saw. I don't think there's any broken bones. Are you comfortable with that plan? But that's something that a few years ago would have put me into a horrible spiral afterwards.
Yeah.
Like, why did I make that? Why did I do that? But I always order a head CT and a cervical spine. It's second nature.
Right.
You know what I mean? So making mistakes, I think, is really, and perceived mistakes really augments that. And that will hopefully segue into home life and shame in medicine, shame as a mother, as a wife, as a doctor. I didn't, it took me weeks to go to the grocery store. I haven't meal prepped. Did my kids eat enough vegetables today? Did I eat enough vegetables today? Did I drink enough water today? It took me 2.5 hours to go to the bathroom during my shift. I'd been wanting to pee for hours. And Dr. Ortiz, here's an EKG. Dr. Ortiz, we need this. Dr. Ortiz, we've got a critical lab value. Oh, Dr. Ortiz, we've got a red coming into room 2. Next thing you know, I'm like, God, why does my tummy hurt so bad?
Yeah. Oh dear. Yeah. No, I mean, that makes total sense. I mean, I feel like it was a concept when I was doing my residency of not eating enough on your shift or not going to the bathroom when you needed to, which sounds so archaic when I talk about it now. Like, it totally doesn't sound real. And also the thought that if you're not tough enough, then you're not built for this job, like that kind of thinking.
Oh.
So then maybe you should do something else, or you should quit, or these kinds of thoughts, right?
Yes. Well, one heavy topic, if you really want to get into, is pumping and breastfeeding in medicine.
Right.
I intentionally chose not to. I work single coverage overnights, and I was worried that I just wouldn't be able to do that. If I can't pee for 2 hours, how am I going to pump? How am I going to take a 20-minute break to pump?
Right.
But I do have a colleague that I work with who does pump, and it's very important to me to make that happen for her. That's her goal. That's what she wants.
Sure.
But gosh, I see her come in and I think that is so much prep work, right? She's got to bring in her, we don't have a refrigerator anywhere. And I'm sure everyone's going to, the OSHA or whatever thing you need to have, but it is what it is. We've got like a mini fridge. I barely feel comfortable putting my canned Red Bull in there, which we can talk about the shame of drinking that another time. But so she has to bring her own cooler. She's got, her whole setup and again, she's just had to be comfortable that people are going to come in and walk in and talk to her while she's pumping. And so it's just, I think that's one that can bring that's a heated, heavy topic when it comes to feeling shame as a woman in medicine, would be pumping and breastfeeding and having children. And when do you have children, right? I remember as a med student, I went to a women in surgery conference because I thought that's what I was going to do, or I was interested in that. And the main speaker had a whole talk about how she hid her pregnancy for a job interview.
Oh, wow.
I
believe it.
No, I'm sure that that's still happening.
You're right.
Or I had a student when I was in med school. One of my co-students, she was pregnant for her ortho interviews, and believe it or not, I don't think she got an ortho residency nod. No doubt, because how could you in the boys' club?
Yeah, that makes total sense. I mean, I think all of us have thought about sometimes if you should talk about our pregnancy at work and how it can be a big deal, like as a medical professional. And I don't know if that's a big deal in other professions. I don't know if it's a problem with women in general, but yeah, I have definitely thought about it.
Well, and then the worst thing to me as an attending is if someone brought up, you're being hormonal. Talk about having to center and regroup and let that 90-second flood of emotion just go through my body and let it pass. Because man, if you want to see hormonal, I can show you hormonal. Or, oh, you're feeling a little emotional today. Oh, you're angry. And those are always dirty words, dirty feelings as a woman. Again, ingrained in us since childhood. And I hope to change that for my daughters. Does that make sense? So they're going to get mad. My daughter will feel so frustrated. She's 4. She can't get her words out. So she'll scream.
Right.
And I just say, wow, you're really upset. Now, one time I tried to scream and that scared everybody. So I decided, that's not helpful. So as a 36-year-old woman, it doesn't go over as well.
Yeah. Yeah. And you mentioned, I think you've mentioned several times about it being built in us from our childhood. I don't know if you can elaborate more on that. Do you think shame is something that's going on from before, or it's just part of this medical profession?
I truly think it's something going on before. At least for me. I know that I felt like I kept getting two different, very contradicting information. My parents want me to be a doctor. They want me to be a doctor. Mm-hmm. And we've already talked about what the ideal physician is, right? So I'm holding up what this ideal physician is. I'm already never going to be the ideal phisian. I do not have the right chromosomes for that.
Right.
So I'm already working behind. Right. So you need to be smart. You need to be opinionated. You need to think for yourself. You need to be your own thinker, but that's not something that we're allowed to be, right? Like we need to follow and do everything that our parents say until we're 18. And now we get to make our own decisions.
Right.
So it's just contradictory information of how can you be independent if you don't get to practice it for the first 18, 20 years of your life? Right. Now I've got to do it in the back portion, right. Not even the back half, because I'm hoping I live till 100. So I'm not even at the halfway point yet.
Right. Yeah, I hope so too. Yeah, and a lot of us, I think that makes a lot of sense. A lot of us have gone through that, those childhood ideals and those perfectionist things that we were expected to do maybe as a child or maybe not. Yeah. And it just spills over.
I'm going to ask you a personal question. Were you the oldest daughter?
No, I was the youngest.
You were the youngest? Oh, how interesting. I was the oldest. And that's also a really fun thing to talk to people about is the oldest daughter type of energy. You know what I mean? And right. Like the expectations there and things like that. So do you come from a family of physicians?
No, I don't. No, there's no other physician in my family. But I think where like I'm from a South Asian family, and there's a lot of people are really, there's a lot of things that having good grades and like being like that sort of thing. It's just very cultural in that sense that you're supposed to be good, and so I think that was a big part of me growing up as well.
Absolutely.
And I think a lot of people who go into medicine are those perfectionist, high achieving individuals. And that is why I think it spills into shame, because there are perfectionist people who are going into this, and then you put them into this profession, which also expects that of you. So I think it might be, I hate to say it, but it's probably a recipe for disaster.
Absolutely. Well, think about it this way. We have this really incredible education.
Right.
We're taught to think.
Right.
What are we supposed to do when we think differently?
Right.
And that's also been my big, I don't want to say burden. That's been the big thing that I carry. I do not think like everyone else. And I have learned that, and I am accepting that at this point. I'm learning how to accept it. I just don't fit the mold, and none of us should, and none of us do. I don't even know what the mold actually is. Again, it's probably just that Norman Rockwell painting,
Right.
which maybe if you could do like a what is it? A link to that down in the show notes.
Sure. Yeah.
And I'll look for it and I'll send that to you. But, I just not, we're scientists. We're here to help live at the cutting edge. We're here to help improve things, yet questioning the dogma, questioning how things have always been done.
Sure.
Is not allowed. And so I wonder if shame too doesn't really come from not living up to our unrealistic expectations.
Right. Absolutely. Yeah, I agree with that. I think it is not living up to unrealistic expectations when I think of it. And then I was reading about shame, and one of the things that came up, that is it okay to be a good enough physician and not be the perfect physician, or a good enough nurse, or a good enough
P equals
healthcare
MD.
provider?
P equals MD. People say that all the time. But I think it's also, we need to learn. I wish that we would have a class or could take a test, or just honestly didn't feel shame saying what we're good at. Does that make sense? There's also shame feeling like, so if I'm bad, how can I have good qualities?
Right.
Does that make sense? And so heaven forbid you learn what your strengths are and play to them. However, I've got my male colleagues that absolutely have no problem doing that.
Mm-hmm.
It's almost like they have blinders up to their flaws. We just don't talk about them, so they don't exist.
Right. Right. I guess, yeah. I've never thought about it that way. Maybe I think their personalities are built differently in that sense, but also they're not being scrutinized so much, right? Like by the outside world.
Or maybe they don't allow that scrutiny in. I don't know. And maybe it's not a male-female thing. Maybe it's just a sensitive soul thing.
Right. Yeah, that's possible. I mean, the other shame that I see a lot in medicine is also surrounding the acceptance of having mental illness, which is also like a lot of shame, not in medicine, but everywhere. But as a doctor, when you're supposed to be perfect, then how can you have anxiety or depression, or how can you be struggling because you have to put that on your licensing application still in several states, or how can you be going to therapy to deal with a profession that is highly anxiety provoking, I would say, and demanding and traumatizing. And still it's a big deal, which is kind of strange to me. And I don't know what you think.
But first and foremost, how can you not have anxiety and depression in this field?
Right.
You're not eating correctly. You're definitely not on a normal circadian rhythm. You're isolated. You don't have your community. This is a breeding ground for anxiety and depression. And then the problem is that ends up building resentment, I think, towards your patients, because I'm now here taking care of you, making sure that you get your basic needs met. I haven't peed. I haven't drank water. You know what I mean? Like, and especially in my situation is a little unique because I work nights.
Right.
And so I now have to switch back to day shift when I'm not working. So that way I can be present for my toddlers.
Right.
So how can it not breathe that? But there's a piece, at least in the Kansas licensure, is there anything that's preventing you? Do you have any things that prevent you from practicing medicine? No. I am a functioning depressed human being.
Right.
It does not prevent me. I take my medicine every day. I do my best to hit my basic needs. And it's something that has helped me. I'm a very visual person. We're all juggling. Right. We're juggling glass balls and we're juggling plastic balls. Sometimes you got to let the plastic balls drop. If you're good. I let glass balls drop a lot of the time. And so then I have to go back and apologize. And, I've gotten good at it. I'm able to apologize. I'm able to make amends easily, which is something I am proud of myself. But again, I don't want to have to always apologize, right? So I'd rather just drop the plastic balls and hopefully they'll bounce back up when it's time.
I like that analogy.
Yeah.
I really like it. I mean, I think you've talked a little bit about this originally, but I guess talking about how can we develop shame resilience in that sense. I think the one thing to fight this is to talk more about it and just create more awareness and to say the words out loud. And so people know that A, they're not alone, and B, it happens to everyone. I guess it's both the same thing. But also working on ourselves as individuals. I know you talked about a little bit about showing kindness to yourself, but how can we develop resilience to this?
I love that question. It's something that I work on every day. I am statements are so powerful. I am kind. I am smart. I am exactly who this person needs right now. I know what I'm doing. Those are affirmations that I really try to say before I go into work or when I can catch myself spiraling in the moment.
Right.
I know what I'm doing. I'm smart. I am an MD. I am a doctor. I am a DO. I know my stuff, And so those are, I think, really important. So I am statements, also loving kindness meditations. I think those are also known as like metta meditations in like yoga and things like that. I love those. And that's something that I've been starting to do regularly. It's really hard and really uncomfortable for me to do self-loving kindness.
Right.
Those are so hard, but gosh, that just radiates out. And I think that makes a huge difference. I probably should read more Brené Brown than I actually do, but gosh, she's got some beautiful quotes and people give me some great tidbits that she's got. And I loved what you had opened up with. If you're a reader, that's a great way to do it. But again, that also brings me shame when I'm like, oh, I should have read that book. Why haven't I finished that book yet? Journaling, I know, is something that really, really helps me. When things are going great for me, I'm able to do 3 pages every day. Ideally, I do morning pages, which is something that we've mentioned, like the artist way and stuff like that. But I think we're all creators. We are all creators.
Right.
Especially as women, we create life. Do you know what I mean? So I think we need to tap into that creative energy, and we can be creative when it comes to medicine in the way that we speak to our patients, the way that we fix a workup or maybe, tweak a treatment protocol or, hey, I know that this is what the paper says, or, our random controlled trial says, but patients don't read textbooks. So maybe let's think outside of the box. So, and again, I think that we could also, what are our gifts, and give ourselves permission to acknowledge our gifts, right? You can't truly be humble unless you know how powerful you are. I heard that on a little clip a friend of mine sent me, and that has just stuck with me. We feel so much, especially for me, is like, I was raised in a Southern Baptist, home. Women are seen, not heard. Women, are in the kitchen all the time. But where that mixed message double standard came in for me is my mom was also the breadwinner. I'm the breadwinner. So how can I be meek and docile and the breadwinner? If something's threatening, the bread I'm bringing in, I got to protect my family.
Right.
But heaven forbid I get passionate. And so I feel like I even at work have to, when I start to really get fired up and passionate, I have to give like a disclaimer, because it makes men uncomfortable. It makes women uncomfortable. It makes people uncomfortable because, you're having feelings that women aren't supposed to have. You're demonstrating something that my mother has never shown me, that that I actually got punished for when I was growing up, or things like that.
Right. Yeah, no, that makes a lot of sense. And I love what you said about the affirmations that you shared, just showing the kindness and compassion to yourself. And you mentioned Brené Brown and Kristen Neff. I also done a lot of work on self-compassion, and she talks about talking to yourself how you would talk to a friend. So like if you had come to me and said, hey, I really messed up, how would I have talked to you? But when we talk to ourselves, we're very self-deprecating and we have that shame involved. So if we bring that kindness and energy to ourselves.
Right. Well, and then if you really want to start to deep dive, there's something called the internal family systems. I don't know if you've ever explored that.
No.
But it's your inner critic. And your inner critic was developed to protect you. And so the inner critic was developed to prevent everyone else putting shame onto you. Does that make sense?
Mm-hmm.
So the shame is, I am bad. You did something bad. You are bad. And so the critic was created to help. Oh, you're doing something bad. Careful.
Right.
Careful. Your badness is coming out. So it was there to help as a warning signal, but unfortunately it gets overdeveloped. It gets hypertrophied.
Oh, that makes sense.
So it's actually, I would strongly recommend if, looking into like the internal family systems. I think that's a really beautiful way to learn about self-compassion, because essentially you want to get to your core self. You know, who are you at your core? And so you've got these protectors and firefighters and things like that to keep that core self safe.
Yeah. And quiet the inner critic a little bit. Yeah. That makes
Absolutely.
sense.
But here's the thing. You want to become friends with your inner critic. I've named mine. Her name is Beatrix with an X.
Okay.
And sometimes I let her come out, right? Like sometimes I let her come out when it's time. But okay, Beatrix, we gotta, like, there's a difference between nice and kind.
Yeah.
And Beatrix knows that, you know, so we put our foot down. We have our boundaries. We have the things that we set up for. But sometimes it's hard for me, Melissa, to say, I didn't like the way you spoke to me.
Sure.
Beatrix has no problem saying that. And I love the idea of the alter ego. Beyonce has Sasha Fierce, you know, and so I think it's important to become friends. She was developed to keep me safe. She does have my best interest at heart. She just doesn't go about it the right way.
Yeah.
You know, we gotta reel her in sometimes. We gotta, you know, keep her at bay. But again, I don't want to critic my critic, because then talk about a shame spiral.
Right.
Or critique my critic, I guess would be the better way to say it. So you don't want to say, why are you shaming yourself? This is so awful, right? Like how are you improving from that? You're staying right there. You're staying right in the spiral.
I love that. I mean, I think, and the naming helps a lot, right? When we name the things which are so blurry and non-existent, I think in our head, it kind of helps.
Takes away some of the power. Yeah.
Yes, absolutely. I love that tip. I think I'm going to do that for myself too.
I hope you do. I hope you share your name too. But again, mine's very important. It's Beatrix with an X.
With an X. Okay. Talking about, I think those were some really great tips, and I really appreciate you sharing your honesty and vulnerability with us. I think just a few questions and we might wrap up. How do you think, because working in organizations and these big institutions and culturally, how do you think organizations can support a culture when shame is not so prevalent? How can we do it as individuals? So what changes can we make for anybody who's listening?
I have loved all your questions. So one of the things that has helped me in this is remembering that the organization isn't a human. I'm going to dehumanize that organization. Now the organization is made up of humans, right? So we're all individuals that we all want to do the right thing. Nobody wants to feel shame, and nobody wants our colleagues to feel shame.
Right.
So I think we need to personalize and remember the organization, the corporation, zero feelings.
Yeah.
You know, they don't have the ability to have feelings because it's not a person.
Right.
So I think it's important to learn the names of everybody you work with. Learn a little personal anecdote about them. Do you know what I mean? I think it's important to me to greet by name every single human that's in my department that I'm working with. Because one, it also helps humanize me. It also helps, I think, if there are mixers in communities and like events that we can get together and see each other outside of work, so that we can remember, sometimes we just have to put on our work armor. Sometimes we just have to put on a different alter ego. Um, for me, I've seen that again, working nights, nope, in the ER. Nobody wants to hear from me at 3 a.m. Nobody, not a single human being. And because, I get to go to bed in the morning, but the people that I called at 3 a.m., they got to get up and go to surgery. They got to get up and go rounds, so understanding that energy interaction, that transaction there, right? One, because I'm also at the height of my workday, right? I've had my cup of coffee, I've had my Red Bull, I've had my snacks. And so my energy is at a 12. And I'm calling somebody, their energy is at a -2. And so I have, when someone greets me with gruffness, I have found that when I name that or when I acknowledge it, it actually makes that interaction a whole lot easier, if that makes sense. And so that shame that they try to put on me is because, well, they just woke up. They haven't brushed their teeth yet. They haven't even gone to the potty yet. Their basic needs aren't met. So how can they think have higher levels of thinking? So just the making sure I come at it at a softer tone. Hey, I've got something for you. Let me know when you're ready. Or when someone's gruff, ooh, it's got to be so hard to wake up early. And I'm sorry that I even have to do this. And just, again, humanizing myself so that they realize, oh yeah, I am talking to another human being on the other side of the phone. Because it's super easy to not be kind when you cannot see that person's face.
Right.
I think we all know that. We have all been there.
Yeah.
So again, humanizing each other within the organization, I think helps. Because again, the organization isn't human, but remembering that the organization is made up of humans.
Yeah. No, that makes a lot of sense. And never thought of it that way. Yes, there are humans, but the organization itself is not human. Great point. And for me, also, I think personally, just if you talk about culture, just having more ease around disclosure, like if there's errors, supporting those cultures where there is more honesty and vulnerability about making mistakes and realizing the humanity of us, right, as healthcare professionals, that we are just humans who are working in imperfect systems, and I've said that before, and not the robots or the ideal physicians that were visualized several years ago.
Yeah, we're not automatons.
Right.
Like that's why do you think I spent hundreds of thousands of dollars on my education?
Right.
Not to think like everyone else.
Right.
But then I feel shame when I don't. Wait a minute, I'm not using my education I'm not honoring that.
Yeah. Yeah. No, that makes total sense. This was really lovely. We're almost going towards the end. Is there something that you have not talked about or you want to say as your parting words and about shame in general and how we can give more worth to that shame and speak more about it?
Well, thank you so much for having me. I appreciate you working with my schedule and being so kind and gracious with having to reschedule. And I just really appreciate you, Saba. Thank you. And I have loved working with you, and I've loved I hope that we continue to create together, to continue to co-create. I think with shame, I loved the quote that you opened up with, give it a name, take away its power. I mean, I obviously paraphrased that, but, and finding our gifts. I didn't really talk about art because that's not my strongest suit, but I've been to art meditation classes where you just take a Sharpie and just draw what you want, or watercolor and things like that. Allow the feelings to get out. That way you're not accidentally spewing those feelings onto colleagues and patients. Spew them onto the paper. And if you feel super uncomfortable about what you wrote or created, burn it with intention. But also, I would recommend saving it because it's really fun to go back and another way to show compassion to yourself. Wow, I was really hurting in this moment. I think looking into the internal family systems would be helpful, but truly understanding that at our core, we are good, kind humans, and we want to do what's best. I am statements are so powerful. I am good. I am good. And not, whenever that critic gets in and I'm bad. No, I am good. And if you have to reset, if you have to ground, figuring out what you need, what I need, because we're so good at figuring out what other people need. But what do I need? Because guess what? Nobody's looking out for me except me.
Right. Yeah, no, that's amazing. I think two of the things you said give the shame a name, take away its power, and then realizing the kindness to yourself and giving that kindness to yourself. I think it's amazing. And let yourself know that it's okay to be a good enough physician. I think that's what I learned from this.
Yes. Well, and I think too, I think we've all heard you can't love someone if you don't love yourself. And that was always confusing to me. The way that I have reframed that is, and I wish I could give credit to the person where I first heard this, but the relationship you have with yourself sets the tone for all other relationships.
Mm-hmm. Yeah, that's really thoughtful. I think we're coming to an end, and really enjoyed this conversation. I've made it a tradition that I end the podcast. I usually read a small poem or quote, so I'm just going to do that, and then we'll finish up. If you'll hang out for me for that.
Absolutely.
So it's from the movie The Curious Case of Benjamin Button, and I think it's written by the screenwriter. But for what it's worth, it's never too late, or in my case, too early, to be whoever you want to be. There's no time limit. Stop whenever you want. You can change or stay the same. There are no rules to this thing. We can make the best or worst of it. I hope you make the best of it. And I hope you see things that startle you. I hope you feel things you never felt before. I hope you meet people with a different point of view. I hope you live a life you're proud of. If you find that you're not, I hope you have the courage to start all over again. Thank you so much. And it
Thank
was
you,
really a
Saba.
great pleasure to have you.